Yolanda, if you want to speak on behalf of anybody else on your side that might not be able to speak, that would be great. But just to understand what some of the backgrounds are, that might be helpful. So I'll just go ahead and start. I'm Ellen Taylor. I'm the Vice President of Research at the Center for Health Design, and my background is in architecture, but I also have a PhD in human factors and patient safety. So Shannon and Jill.
Hi, I'm Shannon Reckline. I'm Operations Manager at the Center. I help to make sure that the knowledge repository is running smoothly. We're transitioning it over to Jill, who's with us, and she's going to be the main support for the group. Jill, do you want to?
I'm Jill Glaser. I'm the project manager for the knowledge repository, and I'm here to assist Ellen and Shannon. You're muted.
I'm Yolanda Keys, and I am the liaison for NIHD for the knowledge repository work.
I'm Kimberly Spray. I'm not sure if this is working.
Yes.
Yeah, it is. Okay, thank you. I am an emergency nurse. I'm very interested in design, and I help to design Ebola treatment units in West Africa.
And Yolanda, can you share anything about Angela's background?
I was just going to say, Angela is the executive director for NIHD, and she is here so that she can help support any of our members who would like to participate in the knowledge repository. And she's actually helped with a couple of summaries in the past herself.
Great. Well, very good. Thank you all for joining. And Kimberly, with your background, there may be some alternate papers I put into your list, because we definitely have a couple about the design of Ebola units and lots about ED environments. But I think there was an ED one in the list that I just sent as well. But we can certainly play around with some different things. So let me just start from the beginning, and then we can sort of go into a little bit more detail with respect to the involvement from NIHD. So the Knowledge Repository is a project that has been evolving over the past number of years. And Shannon, do you remember what year we started this? It was 5 years ago now?
I think it's more than that, but maybe 2012, 2013.
So that's about 5 years. So this really came out of another initiative that we had where we were really trying to help people understand what is the relationship more specifically between the design of the built environment and healthcare settings and outcomes. And as part of that project, where we were falling into the challenge of scope creep and really trying to bite off more than we could chew, we really started to think to ourselves, what would happen if we could at least just open up our EndNote file, basically, of all of the citations that we've used for different projects that we've done, whether it's grant-funded research or whether it's internal research that we've done. So what we ended up doing was taking our initial database and creating an online structure that would allow a transfer between that and our website. And over the course of time, we've looked at different ways of improving some of the functionality, different ways of making sure that it's being kept up to date, and looking at ways that we're trying to be more proactive in terms of capturing citations. So it's no longer just about the projects that we're working on, but we have an active set of alerts that we have in place so that basically on a daily basis, we're getting new information about new citations that might be applicable, and either daily or at some point during the week, we try to take a look at those and do a quick pull into our internal database, and then that has an automated pull into the website, which houses the knowledge repository. So if you're looking for the knowledge repository, and it's been described as the PubMed for the built environment, which I think is just a great way of talking about it. And I take that as a really high compliment coming from a clinician that was learning about this at one point. But it's very prominently displayed on our homepage. So if you go to www.healthdesign.org, you'll see the purple button, which is the knowledge repository. It's one of our more used resources on the website. You can also get there by going to the research tab and scrolling down to the bottom. There's a number of resources that are available as part of research, and the knowledge repository is one of them. So if you click on the knowledge repository button, you will come to the homepage for the Knowledge Repository. And we're very fortunate to have a number of partners that support us in different ways, and NIHD is one of our partners. And your primary role has been in supporting us through writing some key point summaries. So again, we have different types of partners, but at this point, what we've tried to do is focus on different user groups and affiliations rather than targeting any type of a commercial sponsor. That may change at some point down the road, but right now it's a really great group of people that all serve different types of professional associations. So we get lots of feedback based on the types of topics that different groups might be interested in. So the types of topics that you all are interested in may be slightly different than what an engineering community might be interested in or healthcare architects might be interested in. But I think that's also the power of the Knowledge Repository as well. It really has a diversity of topics and a diversity of papers. So if you're here at the homepage of the Knowledge Repository, what we have set up right now is a system where we have citations that get pulled in on a regular basis, as I mentioned before, that are pulled in according to publication date. So the most recent publications are the ones that are going to appear on top, and that will change on a fairly regular basis, depending upon, you know, how often we're pulling in something that is quite literally still in press versus something that we may have found from a couple of years ago that for some reason we didn't have in the database. But in this way, we're hoping that anytime somebody actually comes to the Knowledge Repository, and Shannon, I'm seeing we have a correction on this one from Sarah Byramzada, which I'll fix afterwards. But the goal is to help people understand that this is very current, that this isn't just something that we did 5 years ago, that this is constantly getting new papers. There's multiple ways that people can use this. One thing that we do with the Knowledge Repository is every 2 months we send out what's called Research in a Snap. And that is a document that pulls in all of the citations that we've added in the past 2 months. And we try and provide some categorization so that people can understand a little bit about what happens in some of the different topic areas that might be interested. So if you click on that link for resources, you can find a library of the Research in a Snaps that have been produced, and they're all, you know, by date. So that again, we acknowledge all of our partners in the process, and you can see the listing of citations, and all of them currently will have the digital object identifier so that if people want to go to the full text paper, they have a fairly straightforward way of doing that if they have full text access somehow. The other thing that we've added into the resources is some pretty short video tutorials just to help people understand a little bit more about the Knowledge Repository, what to expect, how to read a key point summary, how to use the search function. And these are all things that have come from feedback from our different partners. The last thing that we have is something that came out of another project that we had a few years ago, an evidence-based design glossary. And this provides some conceptual models for the relationship between different environmental variables and outcomes. And this is maybe a little bit more on the geeky, researchy, academic kind of side, you know, this conceptual framework that maybe doesn't matter to the professionals, but we have it here for those people that, like all of us, probably care about that. So again, it's just something that people can turn to if they're really interested. And we don't have it for every single topic area. Again, this came out of another project that we had, but it's something that we can turn to and use as a resource. And I'm sorry, the controls are just hiding my ability to move around here, so I will just do that quickly. In terms of the search functions in the Knowledge Repository, it's not a full Boolean search, but you can do a contains all or contains any. You can type in an author name, you can type in a topic, you can use quotation marks and type in a specific title, and it will pull that component up. So for example, if we just wanted to do this as an example, if you know exactly what you're looking for, this is the best way to do it because there's probably more than 4,000 entries at this point. So you can see if you use the quotation function, it works just like most searches do and really targets down. In terms of some of the other ways of searching, we have topic categories that have been set up, and we have specific resources that have been set up. So we'll be talking about key point summaries. If somebody is only interested in understanding what can I see that has a key point summary associated with it, you can click on this button and it will bring you to those papers that have a key point summary, and this is shown in the blue. The purple source link is what will take you to the publisher's website so that if you want to access the full text, you can. And the save button is the function that we have so that if you're logged in to the center's website, you can bookmark topics that are of interest to you and then have those saved in a place that you don't have to continually be researching. You can also search by full articles that are available, and these are often reports that have been produced by the center. So for copyright reasons, we're not allowed to post full text papers by other publishers, but if it's something that we have access to or that we've produced, it can fit into one of these different categories. If a paper is an open source paper, we will not post it because again, it's somebody else's published paper, but by somebody being able to click on the source link, they can check and see if it's an open access paper or if it's a free access paper. The other way that we have things categorized, and you'll see this when we start talking more specifically about the key point summaries and writing them, we have filters by design category. So if an interior designer is interested in information about furniture, or if somebody is interested in reducing noise in the environment, they can look at the acoustic environment. If somebody is interested in HVAC systems, they can focus down on that. And we try and have all of the resources tagged in a certain way so that they're searchable by that design category. We also have this set up by outcome categories, and these can be pretty broad. So patient health outcomes as a general category, or staff satisfaction as a general category. You do have some that are a little bit more specific. So whether it's falls or healthcare associated infections or the environmental impact, you know, we do have some that drill down a little bit more. And again, these come out of prior projects that we've worked on. So they're categories that have been established over a longer period of time with the center. They weren't developed solely just for the knowledge repository. A new topic filter that we've added, primarily because we started expanding the scope of the knowledge repository within the last couple of years based on feedback from our partners, is by paper type. So originally what we would have was really papers associated with traditional empirical research. And what we ended up finding over time is that there's clearly interest in literature reviews, because that is an easy way, especially for a designer, to understand at a more global level what do we know about a topic. So we thought it would probably be helpful going forward to specifically identify something as a literature review. And then we've also started looking at some issues associated with, if you're a researcher and you want to know more about specific methods that you might use, we should tag those for methodology. And if you're trying to change the design paradigm and there's a paper that really speaks to the design process, it might not be the exact type of research that defines this is the type of patient or staff outcome that we have, but it defines a little bit more, here's how we had a participatory process, or here's how we engaged nurses in identifying, you know, key points of medication safety. It could be anything associated with a design process, but if that's the focus of the paper, we figured we could tag that. And then of course theory, and there's fewer theory papers that are really relevant to this topic, but again, sometimes research being as retrospective as it is theory is a way that we can try and be a little bit more forward thinking and help people understand what might be out on the horizon. The last thing that we have is by date. And this is something that we corrected earlier today. There was obviously no paper that goes back to year 3. We would like to think that we're comprehensive, but probably not that much. But it will pull in all of the publication year dates so that we can get a sense of where things might fit in, so that you'll be able to say, I only want to see the most recent papers that are from 2018, or I know the paper I'm looking for was published in 2016, so I can click on that and filter it down. And Shannon, I'm not sure if you want to talk about some of the search functionality that we're working on going forward, or if we should save that for another time.
I think we should save it. Yeah, no, it's a good overview so far.
Okay. So let's get into the key point summaries themselves and talk a little bit more about that. So if you click on any of the key point summaries, it exists in 2 formats. So what you'll see when you pull up a page is the same information in terms of the article title, the journal that it was in. If it has a volume number and page number, that will be here. If it's in press, it holds in press until we update the page numbers, and then that will update automatically when that information becomes available. It will give a little bit of a summary of what the key point summary says, if that's there, just to help somebody key in on what the paper might be about more specifically. We don't include the publisher abstracts. Again, that's copyrighted material. So the key point summary is really a different way of trying to summarize the information for this audience in a slightly different way. So the key point summary exists in both a web-based format, so it's an HTML format, as you can see here, but it is also transferred into a PDF format so that people can have a library of PDFs. They can share this with a client. There's different things that they might be able to do with PDF that they wouldn't be able to do with an HTML version. And again, this is, toolbar is hiding this. With some of the key point summaries, that particular key point summary was written by our new investigator last year, Lori Reynolds. Here's one, paper by Yolanda Keyes. And what we'll have here is who wrote the key point summary so that you actually get credit and acknowledgement that you were working on this for the center. So in running through the content of the key point summary, the primary audience that we're trying to help is a combination of architects, designers, clinicians, other practitioners, basically a diverse group of stakeholders that are involved in healthcare facility design. And typically what we're trying to help them understand is what are the key concepts that are associated with this study? What was the real objective? For those that care, what were the methods that were used? What were the findings at a fairly high level? And then the really important component is the limitations and the design implications. So the design implications are always pulled out in a purple box. The limitations are something that may be author identified limitations, and they may be limitations that you as a nurse researcher or just as a reviewer would say to yourself, well, that seems like a small sample size. I think I should note that within the limitations. Or it seems like you know, it was a qualitative study and they didn't really acknowledge that they were actually a nurse working on that unit. So maybe there was some bias associated with how the qualitative study was done. Some of this is going to be your own interpretation and your own comfort level with defining things, but certainly if the authors have identified limitations, that should be included in the key point summary. For some of the things that have come up with some of the papers from NIHD, again, these may be slightly different than the traditional research paper that you might find where we're talking about, for example, the lighting level in a medication prep room, where the design implication would be fairly straightforward and an architect would looking at it would feel like, okay, I have an answer to my problem. I know that I need to make sure that the lighting levels are at X, or that the lighting is distributed in such a way that we're not casting shadows, or you know, whatever the actual nature of the study was and the relationship to the environmental feature and some type of outcome. With some of the papers that we look at, especially when it comes to some of the ones that may be of more interest to you, it may not be that direct a correlation. So what we're asking in terms of design implications, if there's not a specific feature to outcome relationship, to help somebody understand why would it matter in terms of design. So if, for example, it has to do with how nurses engage in the design process, then in that design implications part, really try to help somebody understand. If I were trying to explain to somebody why this paper was highlighting an important issue about participation in the process, what would I say about that? So it can be a different type of design implication, but we ask that that get pulled out separately. Sometimes when you're working on these, there will be a fine line balance between what you're reporting in the findings and what you're reporting in the design implications. And we've had situations in the past where the information may be put into the findings section, and then the design implications, the tendency is to say, see the findings. We don't want it presented that way because of how it gets filled in with the PDF and how it gets filled in this online format. So at some point, you know, you may be getting feedback, or you may just need to be aware when you're working on this that we actually do want to see that in two separate categories, and the implication may be a finding, but we would like it to be pulled out separately. The other thing that I think is really important to understand, 2 points. One is that the goal here is not to recreate the entire paper. The goal is to make sure that people have some level of understanding of what is contained in the paper and have some kind of a takeaway, but is not to get to the point that it's just rewording everything that was in a 10-page paper. If somebody is truly interested in the paper, they should have enough information to be able to say, it's worth my trying to seek out this full text paper, or I'm actually willing to spend the $30 on this paper. The story that I share with people is there have been times certainly where I can't get a paper and I plunk down that $40 and I read the paper and I am just so vastly disappointed that it is not what I thought it was going to be. So this is really intended to get people to that next level, and they may not need a full text paper. This may be enough, but again, it gets them to that next step. And the other part of that is just to understand that we need to be very careful about cut and paste. And it's certainly easy to just drag and drop and pull things over into the form, but we want to make sure that this is not infringing on any copyright issues, and this really is your own interpretation of the paper, and trying to keep it, you know, at that summary level as an individual author. So with that, I will stop sharing this for just a moment and ask if we have any questions, and then we can move on to the form itself, which should be fairly self-explanatory, having gone through some of the summary of the knowledge repository. So any questions?
No questions from me. I just, you know, I'm familiar with the repository, but every time you go through it, I'm just amazed at this resource you guys have put together. You've done such a beautiful job.
Thank you. Well, so have you. It has been a group effort. So I'm just going to scroll back for a second here while I'm not sharing, just to check on something. So just bear with me just a second. So I'm going to share the form now. And what I was just checking, right now we have 4,064 entries in the knowledge repository. So again, if you've not spent time in it, you know, it might be something that you want to take a look at some point, just to get a sense. So this is a filled in form. This is from one of our key writers named Yolanda Keyes. So this will, I think, provide a pretty good example in terms of what it can be, not necessarily what it has to be. Typically, we would like to keep these fairly brief, and depending on the paper, it can be very brief. There are some papers that are very comprehensive, and it may be a little bit harder to try and distill that information down. So I present this in the context that it can be short. You may not be able to keep it as short as this, but again, it doesn't have to have every single detail in the paper. It's really trying to define, what are the key important takeaways. So as we just saw on the online version of the knowledge repository, there's just basic information around the title, the author, the publication. This will actually get linked in a different way between what you submit as a key point summary and then what's in the database. So don't worry if there's a typo or something in here, that will get resolved when we're actually making the correlation between the key point summary and the entry online. But the main components that you're looking at are what we just went through: the key concepts and the context of the study, the objectives of the study, the methods of the study, the findings, the limitations, and the design implications. And then all of those filter features that we were just looking at, that will happen in the tags category. And you can pick more than one. So you can select all that apply. So if it has to do with interior material and unit configuration and furniture, you can select all of those. We have an outcomes category as well. So again, it may be a combination of patient and staff satisfaction, and you can certainly click on both of those. And those will all make the key point summary more findable when somebody's trying to take a look at that. I think, Shannon, we're still using the condition categories in the setting.
Yes, we are still putting that in there.
Okay. So we have these environmental condition categories that come from that framework that we shared a little bit earlier. These may not always have something that seems to make sense. So if it's not applicable, don't feel that you have to check one. The setting, we just try to keep track of. A lot of the research happens in hospitals, but increasingly we're finding research that's being conducted in long-term care facilities or in ambulatory care facilities. So we just like to have a record of what the setting is as well. And again, some of this, may be happening now. It may be future search capabilities as we move forward. So this is the basic form that you'll be presented with. And then what we try to do is search in our database for papers that we think are going to be of interest to the writer, to try and at least keep it a little bit more interesting. So we're open to having you make suggestions of what you think you might be interested in doing, and we can do a double check to see, first of all, if it's in the knowledge repository, and if it's not, should it be? If it's in the knowledge repository already, has it been assigned to somebody else? Or is it something that we just feel like maybe not right now, we need to move on to something else? So we recently sent 12 potential papers for your group to take a look at. And as I was mentioning at the beginning of the call, we really tried to focus in on issues that had to do with nursing so that it would seem to have more of a level of interest for NIHD members and potentially have more meaning to them in terms of a key point summary in the knowledge repository. To the extent that, Kimberly, we just heard about some of your interests, if we wanted to do a couple of swaps, we're clearly open to that. And if anybody decides that they just love writing these key point summaries and they want to do more, we're always open to that as well. We have plenty on the list that need to be taken care of. So again, if you're really enjoying it, or if there's something else that you're working on and saying, hey, as long as I'm going through this for this other project, it wouldn't be so bad to just put it into this template, just touch base with us, and we're happy to work with you on some of that. So Shannon and Jill, I'm not sure if there's anything that I'm missing that you want to jump in on.
I don't think so. I know that we've shared both the form essentially to fill in with some more descriptions of what you should include for each of these sections, but then also an example of one filled in, kind of like what you're seeing on the screen. So it should help you as you start writing to see what is needed for each section. And then I think that with Yolanda, we've sent Yolanda the articles. So with her, if you can find a way to figure out which articles people are going to do and as mentioned, if you want to do more or if you want to swap, we can do that as well.
And I think if there's, so I know that Yolanda's a little bit more experienced with us now, but at the beginning, I know that you were also looking for some feedback and really trying to understand, is this really what you're looking for? It's fairly open because each group of stakeholders is going to have a slightly different takeaway from it, and that is part of the process. But we also try to do feedback with individual writers, especially at the beginning, just to make sure that people are on track and, you know, a little too much detail here. Maybe you don't need all of this, you know, be careful about cut and paste. You know, this section doesn't really seem to capture some of what we thought was important in the paper. Just go back and take a look at that. So you have the opportunity to get that initial feedback. And then we do spot checks on a fairly regular basis, just as part of our quality improvement process. So at some point when we get batches of key point summaries back from individual authors, we'll just pull out 2 or 3 to take a look at and just make sure that it's on track with what we've been seeing in the past. And as people go forward and depending upon their schedule, there's obviously things that may change and people may be rushed and missing things at some point, or they may be really interested in that topic and writing maybe more detail than they should in something. So these are all things that we just, you know, on that spot check basis, just try and make sure that everybody's on the same page as we're moving forward.
And I believe that Yolanda has said that we're going to have this batch of 12 articles be completed by September 1st. So that's going to be something that we'll have our target date be. So.
Well, I want to thank NIHD, all of your members, for being supportive of this process, and for you that made the time for this call today. We're looking forward to continuing to having a great relationship and seeing some of the things that are coming out of this. So spend some time poking around on the Knowledge Repository, the PubMed for the built environment.
Very, very nice. Thank you so much. And we have several people who have stepped up to participate. They just weren't able to make the call today. So thank you very much for being willing to let us record this.
No problem. I'm going to stop recording now.